Welcome back to TMZ Live. And here in LA, where the virus is still just wreaking havoc at our hospitals, there is a battle, it seems, going on between the county health department and the people who have to actually administer the vaccine. And the battle is over what are the regulations for prioritizing people to get the vaccine and what to do if you have leftover vaccine at the end of the day.
And the reason, Charles, they have leftover vaccine is simply because some people, a lot of people, have not been showing up for their appointments. We're going to use LA County as an example. Everybody in the country should watch this because it affects you. And this has to be done in every community. There needs to be a wait list so that if at the end of the day these clinics have extra vaccines that would spoil since they had to take them out of the refrigeration, they have to put them in people's arms within 3 or 4 hours or they're gone. They go in the trash. LA County has not been clear about what these clinics should do. Can they create a wait list? If so, who goes on the wait list? And if there is one, what order do people get to get vaccines if they're on that wait list? There is no guidance, and these clinics don't know what to do. One took the initiative, Charles.
Yes, that would be the Men's Health Foundation here in LA. And joining us right now to talk about how they sort this all out, can it be sorted out with the county, is the doctor who heads up that foundation, Dr. Tony Mills. Dr. Mills, welcome to TMZ Live.
Thank you. Good morning. Thank you for having me.
Good morning, Dr. Mills. So look, we have been doing stories on your clinic because I know that you did have a wait list. That's how we found out about this. How did you come about doing this? Did you have a problem before you had a wait list that caused you to create one?
I mean, it just seemed intrinsically the right thing to do to have a wait list and prioritize people on the wait list in case there was available vaccines. And so we did that from the beginning. And obviously we try to make sure that we don't have excess vaccine at the end, that we utilize everything that we mix and that we draw up. But inevitably there's going to be some residual vaccine that doesn't get used because of missed appointments or canceled appointments. So we can't let that vaccine go to waste.
But when you made that decision, what guidelines had the county given you? Because it seems like by making that decision, you were going outside the guidelines they had provided.
Well, I think that, you talked a little bit about a battle. I don't think it's really a battle. I mean, I think that the county and the providers are on the same team, and we're all working to do the best we can to stem this health crisis. So I think everybody on the team, whether I'm playing forward or I'm playing center, I've got to figure out what's the best thing I can do to make, to help us win this game against the virus. So what we did was, we tried to vaccinate as many people as possible. We stick to the county guidelines. There was some guidance there that, as you said, about, if there's vaccine left over that's about to expire, that it may be administered to people in lower priority categories. But I think everyone was afraid of being judged for that. And obviously, you don't want to be giving it to, your friends and family and neighbors. You want to try and administer the vaccine to the people who are prioritized. But if there's vaccine left, let's give it to people who are at a lower priority level.
So I will say, doctor, because I believe you have done not only the right thing, but really the heroic thing, because the county's regulations are so vague, and you stepped up to the plate. However, when we called you guys initially, and I'm not saying this at all as criticism, I think this just shows the problem with the county. We had problems getting an acknowledgement that you had a wait list. We were told by the receptionist you did, and then we were told you didn't. And I kind of felt like you guys had appropriate fear of disclosing it because the county was so vague.
And maybe that's true. Maybe people were a little concerned about the media. I think that, everybody's really dedicated, Harvey, to the work that we're doing. And, I sit out there and I watch people in my employ who are dealing with the angry mob. I mean, people show up who are not a part of the group that's targeted right now. They bring their family, they're demanding vaccine. It's a very difficult job. And so I think people are, but people still show up every day for work, and they do that because they know what they're doing right now is so important. And so if they were hesitant to disclose that, maybe it was just that they wanted to protect something that they felt so strongly about.
Well, look, keep it up, Doctor, because this is what's needed. And God, I hope the county would just simply clarify this, just put out a rule and just say, you should have a wait list. And here's who can be on the wait list. And here's how you pick people from the wait list. It would be so simple. It would take 10 minutes to write this and distribute it. Thank you for what you do. I hope others mimic what you do as well, Doctor.
Thank you. You guys have a great day.